Yeah, this study is part of a larger birth cohort study that was conducted in North Carolina and Pennsylvania in rural areas where families were recruited at the birth of their child to basically study what it's like to grow up in rural poverty. So that was the intent in general. This study specifically is looking at all different types of exposure to nicotine and its metabolite. First-hand smoke is obviously, if you're smoking something, can be a regular cigarette or an e-cigarette. Second-hand smoke is what other people inhale around you while you're smoking. Third-hand smoke, though, is the residue from someone who's been smoking. It's invisible, but it basically settles into things like carpeting, drapery, any kind of soft object, even your clothing and your hair when you're smoking. Everyone knows you really shouldn't be smoking around children, secondhand smoke. What people don't realize is that this residue persists, and infants and toddlers who are crawling around on a floor, they pick it up on their hands, their feet, and then they put them in their mouth, or they're just absorbing it through their skin. So it doesn't have to be in the presence of a smoker. In fact, it can be a non-smoking family that has moved into a house or an apartment where the previous person smoked, and it still remains in the carpeting, draperies, things of that nature. What happens is when someone smokes, there's an invisible residue of nicotine that settles down, and then as the infant ingests it, or toddler, they're crawling around on the floor, they put their hands in their mouth, etc., or even a toy that's been exposed to it. And what happens is in their body, that is basically transformed into something called cotinine. It's that we examine through looking at saliva samples from the infants and toddlers and young children at 6 months, a little over a year, 2 years, and 4 years of age. What happens is, with children, we actually took saliva samples from them at 6 months, a little over a year, 2 years of age, and 4 years of age. And that's what we looked at to look at the nicotine metabolite called cotinine and how much was there. And what we found was 15% of the children had a level of cotinine that was the same as an adult smoker who had just smoked a cigarette. But over 60% had more than a small amount in their saliva, meaning they had been exposed to the nicotine through third-hand smoking. There's a lot we need to know because part of the problem is how you measure exposure. You know, do your parents have to smoke, secondhand smoke, and this third-hand smoke is really something that's just being understood now. And because of that, there's a lot we need to learn, which is why we're continuing to follow the children up. However, in animal models, they have shown that rat pups exposed to nicotine very early on, when they reach their adolescence, they're more likely to become addicted to nicotine. So there seems to be something going on in the brain that maybe predisposes towards addiction. Obviously, the best thing to do if there's an active smoker in the household is for them to quit. Or failing that, to smoke outside to at least minimize the residue. But say, you're in a situation where you have to do something, the best thing you can do is shampoo carpets, draperies, any soft object where the nicotine can accumulate over time. And to be aware, if you're moving into a new house or apartment, it's probably a good idea to do the shampooing if you have an infant or toddler to minimize the risk.